Okay, today we are going to go over preventive health and what is covered by most insurance companies at 100%. Please keep in mind, I'm not your broker. This is not specific to your benefits. This is just general information about how many insurance companies define preventive health. And if you do have preventive health covered at 100%, this is most likely how it's all going to work. All right. And step number one into understanding this is understanding that there are two categories. There's preventive care and diagnostic care. So diagnostic care is when you go into the doctor with a symptom, you have a sore throat, you have an earache, something like that. That is going to be categorized immediately as diagnostic care, and you are going to be subject to copays and coinsurance. Now, preventive and we're going to go over how that's defined by your insurance companies and the under ACA. And it's when you have no symptoms at all. You're just calling, you're basically saying, I want my physical exam, my checkup, and go in, no symptoms. All right. So all of those are going to be covered at 100% for most everyone. So what we're going to go over is we're going to go over adult preventive care, and this is a general list of what is going to be covered for adults, and I'll go over it briefly. We're going to go over in more detail here in just a moment. But drug and alcohol screenings, anxiety and depression screenings, heart screenings, behavioral health, high blood pressure, bone density, cholesterol, colorectal, your colonoscopies, diabetes screenings, exercise intervention, hepatitis screenings, and sexually transmitted disease screenings, and so on. Now, I just said exercise intervention. I know that many of us define preventive differently than the insurance companies and the government. So when I think of preventive, I think of getting all of my vitamins levels checked. If my B vitamins are low, I'm not going to be feeling so great. And if this is low or that's low, I want to be in optimal levels. There are different types of labs out there. They're going to be checking if you're deficient or if you're just low or you're in a certain range. Different labs and different doctors define this differently. Blood tests that are there to help you optimize how you're feeling are not going to be covered under preventive. You, in your own mind, may define it as preventive, but the insurance company and the government do not. They look at these very specific guidelines, and these are all defined by the FDA and the CDC. The insurance company is just following suit, and they're just following what the guidelines are put forward by the government. Exercise. So many of us would consider going to the gym preventive, preventing you from getting sick later, right? Well, that's not necessarily the case. They do have some programs for those, like I said, 65 and over. You'll see silver sneakers, and you'll see a lot of Medicare supplement plans covering gym memberships for 65 plus. But for the rest of us, we are going to have to pay for our gym memberships and our personal training and so on. We also have the preventive healthcare section for women. So in short, it's going to cover breast cancer screenings, sexually transmitted disease screenings, counseling related to genetic testing for ovarian cancer, and drug administration approved contraceptives and contraceptive counseling, HPV screenings, pelvic exams, pap smears, pregnancy screenings, urinary incontinence screenings, and your well woman visit. In short, all of the immunizations are going to be covered. All the immunizations covered by the FDA, or approved by the FDA, are going to be covered. And you have your child preventive care, which we, again, will go over in more detail. But in general, you're going to have your anemia screening. I don't know why I keep saying screaming. I think of kids and I think of screaming. Anemia screening, anxiety, depression, suicide risk screening. And keep in mind, this is all children. So some of this is going to be for babies and some of it's going to be for adolescents and some for teenagers. cholesterol development and behavior. You've got your vision and hearing screenings, height and weight, of course, blood screenings for hemoglobin and blood count, sexually transmitted disease screenings for those that are age appropriate. We'll go over that in more detail as well. Lead testing, newborn screenings, obesity, oral exams, skin cancer screenings, tobacco and alcohol related assessments, and vision and hearing. So in that list for children, you hear dentists and optometrists, you hear vision and dental. Yes, many of these ACA compliant plans cover vision and dental for children. So keep that in mind. If you are paying for a health plan, you may have dental and vision benefits built in automatically. You may not, but some of these do build them in directly into the health plan. Immunizations for children, again, all of them that are approved by the FDA are covered for children. You follow a vaccine schedule, and those are all going to be covered at 100%. I'm not going to go over all of these, but in short, it's going to be your measles, mumps, it's going to be flu, chickenpox, polio, RSV, whooping cough, COVID, all that good stuff. Now, there are some pharmacy items that are going to be covered at 100% if your plan covers preventive health benefits. And keep in mind that you have to follow the age requirements. You have to fall within the appropriate age for these medications. You also have to go to an in-network pharmacy, and some of these prescriptions include over-the-counter medications. So even with that, even if it is over-the-counter, if you want it covered at 100%, you do have to get a prescription from a doctor. Or any breast cancer risk screening medications, aromatase inhibitors, and so on are going to be covered at 100% by the insurance company. Contraceptives, generic prescriptions, OTC, and condoms and spermicides are all going to be covered at 100% by the insurance company. Folic acid for women under the age of 55 who are wanting to become pregnant. Low dose aspirin for women at risk of preeclampsia are going to be covered at 100%. Other adult related prescriptions that may be covered for you at 100% are aspirin, colonoscopy, statins. So you've got statins that are going to be covered, HIV prevention medications, and tobacco cessation. So tobacco cessation products can include medications that reduce cravings for the individual, and they all have to be FDA approved brand and generic over the counter and prescription products. So in short, they have to be FDA approved. It's not going to be, some of these new psychedelics that may be showing some promise in handling addiction or curing addiction or managing or helping with addiction. Unfortunately, it all has to be covered. It all has to be approved by the FDA before the insurance company will even touch it or think about paying for it. That probably goes without saying, but it's fun to bring up anyway. Some health plans do cover preventive costs or do cover dental and vision for children, and that would include dental fluoride treatment for children as well. Preventive care guidelines. So we're going to get into some more visuals here for those of you that need more of a chart. And I do have this available for you. So if you do want a copy, feel free to reach out to me directly. I would be happy to give you a copy. Please keep in mind, I'm not the broker. I do not manage your health benefits. So this may or may not apply to you. If you want a more specific preventive health flyer or information, you will have to reach out to your own broker directly and get that directly from them. But This is general information and I'm happy to provide it if it's helpful in any way. This is the schedule for the well baby exam. So you'll see that, and if you've ever had a baby, they go to the doctor all the time. So obviously it got at birth, and these are all months. So 1 month, 2 month, 4 months, 6 months, 9 months, 12 months, 15 months, and 18 months, 24 months. All those visits are going to be covered at 100%. Then you've got basically every time you go in, they weigh them, they check their circumference of their head, and all of that is included in the exam. They look for congenital heart defects, that's covered, hearing and vision. Oral and dental starts at age 1. That is covered at 100%. The blood count, the blood test is covered. Lead testing, autism testing, postpartum depression is tested, blood pressure, lipid disorder, risk assessment, tuberculosis. That's all covered at those ages. And then we get into 2.5, 3, 4 years, and these go into ages in years. So you've got 2.5, 3, 4, 5, 6, and so on. It goes every year thereafter, after 2.5. And of course, you've got the vision and hearing testing, the height and weight, developmental testing, lead, lipid disorder, blood pressure, blood count, and tuberculosis. Then we get into ages 11 to 20, and they start testing for tobacco risk, alcohol risk, drug risk, and all the sexually transmitted diseases at age 11 for the most part. And the rest is pretty similar to what it was before. The weight, the height, the oral, the testing, the dental, the fluoride treatments, the cleanings, all that good stuff, hearing and vision, and then they add the sexually transmitted diseases and the drug and alcohol piece at age 11. We get into the women's screenings, which are probably close to being just as complicated as the babies. So we've got the height and weight. Well, really not. No, I mean, we basically have everything everybody else does. But we have the cervical cancer screenings, the pap smears, and the like this, the mammograms. Checking the boobs. So, of course, they're going to check the height and weight and the body index, the body mass index, just like everything else. Blood pressure, cholesterol, diabetes, and then we get the breast cancer mammogram week 4. Okay, it starts at age 40. Pap smears basically once every 3 years, all the way up to age 65. It may stop at age 65 depending on your history. And according to the FDA, if the previous 10 years, when you hit age 65, if 55 to 65, everything was normal, you may not need to continue screening past 65. But if you had any abnormal screenings, they're going to continue screening, and that will continue to be covered. And of course, we have the colonoscopy, which most people, if it's their first time, are pretty nervous about. That starts at age 45. Like I said, the test kit or the prep kit is covered through the pharmacy at 100%. The colonoscopy is going to be covered at 100%. However, the anesthesia is a whole other topic. So some people want to be completely put under. So that unfortunately is not going to be covered. However, what you should do is go to your whoever's doing the procedure and ask for a predetermination of benefits. Predetermination of benefits is when your insurance company sends in the exact diagnosis codes, procedure codes to your insurance company and spits back a document that shows what the claims are going to be to the patient. And they can run it multiple ways. They can see what it is with anesthesia, without anesthesia, what is it with general and local, and they give you those options. So ask for that from your medical professional before you get the procedure done so you don't have any surprises. Then, there's some other stool-based tests that are also covered at 100%. Of course, like we talked about before, contraception is covered at 100%. Doesn't matter if it's an IUD, if it's pills, if it's patches, Uva ring, it's all going to be covered at 100%. Talk to your doctor. They will give you all of those options. Contraceptive counseling, glucose screening for diabetes, hepatitis, and osteoporosis. Okay, so that's for women. For females that are pregnant, we get into a health screening for depression, diabetes. So wonderful liquid that they give you, and they test for uh, prenatal diabetes. We get into blood count, hepatitis B, HIV, rubella, a bunch of urinalysis. So all that's going to be covered for women. Also breast pumps, any kind of breastfeeding, support, counseling, coaching, that's all going to be covered at 100% by your insurance company. And you can basically choose any breast pump you want. You do have to go through a provider that is covered by your insurance. They're usually DME, durable medical equipment sort of companies that give you a host of options, mobile ones you plug in, you get a bunch of options. So all those are going to be covered at 100% through the insurance company, as long as you go through one of their DME providers and they mail it to you most of the time. Other tests and screenings, blood tests, cell-free DNA. So if you are pregnant and one of the previous tests come back abnormal, there are additional tests that can be run, and those can also be covered at 100%. However, always get a predetermination of benefits from your doctor to see if it is covered or if you have any out-of-pocket costs before you get the tests. Okay. Of course, all the ultrasounds are going to be covered as well. We have some immunizations for pregnant women that are covered, measles, mumps, and so on. Talk to your doctor as to which immunizations they recommend and evaluate your own risks. So then we get into adult screenings for men. So this one is probably the most simple, right? So it's a wellness exam. You know, they check your height, your weight, your cholesterol, check your blood, check your blood sugar, check your heart, hepatitis C. All right. Then when it gets more complicated is the colonoscopies, basically. Colorectal screenings. I don't know why that's so colorectal screenings. Hard to say for me. Starts at age 45, just like with the women, and it is covered at 100%. Anesthesia is another story, so please go get a predetermination of benefits from your doctor's office. This is where they send the exact procedure and diagnosis codes over to your insurance and send it back with the exact quote, we'll call it, documentation that show what you will pay when you get local anesthesia, general anesthesia, no anesthesia, and what all that is going to look like. So be sure to get that done. Also, all of the stool testing is covered at 100% by your insurance company if you have preventive care covered at 100%. Right, then we've got a vaccine schedule. This is all just general information from the FDA. They give, what's needed at what they recommend at birth, 1 to 2 months, 2 months, 4 months, 6 months, 6 to 18 months, 12 to 15, and so on. And it goes all the way to age 65. So again, if you're interested in this information, you can message me. I'm happy to send it to you. Please keep in mind, I'm not your broker. This is not specific to your benefits. This is just general information about how many insurance companies define preventive health. And if you do have preventive health covered at 100%, this is most likely how it's all going to work. All right. So that's the vaccine schedule and preventive healthcare in a nutshell. Hopefully you found that useful. Thank you for hanging out until the end. If you do have any questions, please feel free to make a comment below. Please like the video, subscribe. If you are an employer, HR manager, CEO, CFO, decision maker within your company, please feel free to reach out to me for a free assessment of your medical or employee benefits. Thank you for hanging out to the end. Looking forward to speaking with you, and I will see you next time.